Once a woman is in her 20s, that's her time to really say, this is when I need to take charge of my own health. I need to eat a healthy diet. I need to exercise. So learn how to cook for yourself if you haven't already done so, making sure you have lots of fruits and vegetables, lean meats, multi-grains. Well, here in America, we have a really big problem with obesity. So normally that shouldn't be the main issue that women in their 20s are dealing with, but it is here for us. And then sexually transmitted diseases. We've coined the phrase here in our office saying exchange your paperwork. So I would want you to get a copy of your paperwork and then request the same from your partner. Say, these are the tests that my physician has done for me. Where's your paperwork? And then you can start having a healthy conversation about sexually transmitted diseases. How are we going to do to remain STD free using condoms every single time? At that yearly visit, you should also discuss with your doctor, what can I do to prevent pregnancy if you're not ready to proceed with that? Definitely have that discussion with your doctor, what birth control is best for you, so that we can discuss preventing pregnancy in addition to preventing sexually transmitted diseases and HIV. Well, at your yearly exam, you should definitely discuss with your doctor testing for your blood pressure. The goal for your blood pressure should be less than 120 over 80. Make sure that you go to that visit fasting so that your doctor can get an accurate total cholesterol and your LDL and HDL. Also, a good test, especially since we're dealing with so much obesity, is also screening for diabetes. So we do a fasting blood glucose. We also check your baseline kidneys, liver function test. Women in their 20s need a pap smear, especially if they're sexually active. The recommendation is if you're sexually active by 21, you definitely need to have a pap smear. What we have done in the past until recently is a pap smear every year. Women in their 20s now, it's recommended that a pap smear every 3 years, but STD testing still every year if they're sexually active, especially when they're changing partners, which women tend to do in their 20s if they're not married. So pap smears every 3 years, STD testing every year. Definitely discuss with your doctor if you've had an abnormal pap smear, those recommendations change. So make sure you talk to your doctor about what is right for you. For my patients in their 20s, I really stress the need to eat a healthy diet and exercise because this shapes your habits for the rest of your life. So if you believe in eating a healthy diet, exercising regularly, drinking plenty of water, that says, okay, this is how I look and this is how I feel when I do these things. So it encourages you to keep that behavior up beyond your 30s, 40s, 50s to establish a lifetime of good health care.